Hello everyone, welcome to my channel Denttract. In this video, I will be covering only the high yielding facts we need to know. These are the fibers which are present in the pulp. So what you need to remember is number 1. The myelinated fibers are more in number than the unmyelinated fibers. A delta and A beta, they are the myelinated fibers, whereas the C fibers are unmyelinated. Number 3, the pain produced by the A delta and the A beta fiber is sharpshooting, transient, very important, and localized. Remember this. Whereas the pain produced by the C fibers is continuous, dull, sometimes excruciating, and it is not localized, also called as referred pain. I hope it is clear. Now, the pulp tests. They are the sensibility test and the vitality test. In sensibility, we see how much the pulp is sensitive. That is, we assess the conditions of the nerve. Whereas the vitality test is a true test in which we assess the condition of the blood supply within the tooth. In this video, I am focusing only on the thermal pulp test and the electric pulp test since they are most important diagnostically and theoretically. Okay. So before jumping onto the thermal pulp test, we must first see what is the response of the tooth to this thermal pulp test. So when we apply cold to a tooth, what happens? We see the movement of dentinal fluid outwards. Why? Because on applying cold, we see vasoconstriction, which causes the movement of the fluid outward. Whereas on applying heat, we see vasodilation, and thus the pressure within the pulp falls and the fluid moves inwards. Whereas in hyperosmotic solutions, where there is less water, we see movement of fluid towards the hyperosmotic solution as it contains less water. Okay, now the thermal pulp test. It includes cold and heat test. Now, location. The source is applied on the mid-buccal region. Why? Because the enamel in this region is thinner than the incisal region, and we don't apply it on the cervical region as it can cause damage to the gums or the soft tissues, right? Now the time, I have mentioned it. For cold test it is less than 15 seconds, and for the heat test it should be less than 5 seconds. Now the electric pulp test. Location. For anterior teeth, we apply it on the incisal edges because the A delta fibers, they are most predominant in this region. Whereas in the posterior teeth, the A delta fibers are predominant in the mid-third region. I hope it is clear, guys. Why do we apply these sources on particular location, right? So now the important things which you should know. If the tooth is immature or it is traumatized, whether you do thermal pulp test or electric pulp test, there will be no response because in trauma, the plexus of Reshko, that is the A delta and the A beta fibers, are cut off, right, due to trauma. Whereas in immature teeth, the plexus of Reshko is not well developed, that is the A delta and the A beta fibers have not penetrated the dentinal tubules. So we will not get any response for immature and the traumatic teeth. Number 2, In hyperthyroidism, there is hypercalcemia. You can check that why there is hypercalcemia in physiology books. So when we have hypercalcemia, we know that calcium blocks the sodium channel, and sodium is important for the generation of the action potential. So if there is hyperthyroidism, there is hypercalcemia, so we require twice the current which is required in normal electrical test. Okay. Now, the third point, when we have crown, how do we test them? Remember, the cold test is the most effective for crowns. But if you have to use electric bulb test, we cannot place it on the crown. We have to place electric bulb tester on the tooth always. So how does we do that? There is a method called bridge method. We apply a probe below the margin of the crown on the cervical region of the tooth. Okay, and on the probe we placed our electric bulb tester, or we can directly use electric bulb tester which are specifically designed for these areas, that is micro electric bulb tester. And yes, one more thing, for traumatic teeth we will get no response until 4 to 6 weeks because it is a healing period for the nerves. I hope you are clear, guys. If you have any doubt, please comment in the comment section. I will be very happy to help you. And yes, if you like the video, please subscribe and hit the like button. Thank you, guys.